Welcome to our Albany Pride episode. We're highlighting some of Albany's LGBTQ advocates and resources as we celebrate Pride Month in June. First, Jill speaks to Tandra LaGrone of In Our Own Voices. For 22 years, this organization has been providing education, advocacy, and direct services to lesbian, gay, bisexual, and transgender people of color. Tandra and In Our Own Voices have been in the news lately for spearheading the painting of a Black Lives Matter banner, complete with pride flags at each end, on Lark Street earlier in June. Here she talks about how LGBTQ people of color are dealing with civil rights, human rights, marginalization, and oppression. In the second segment, Jill talks to Perry Junjulas and Todd Kramer from the Albany Damien Center. The center has been around since 1988 and is dedicated to helping people living with HIV and AIDS access medicine, housing, food, healthcare, and support. Perry, who has been living with AIDS for 25 years, talks about how the center's approach to serving people has changed from the early days of the AIDS epidemic until now. Todd talks about how the Damien Center pivoted during the COVID-19 pandemic in order to continue providing food, housing, and all-important social connections to their clients.
Today I'm going to be talking with Tandra LaGrone from In Our Own Voices. We're going to be getting to know a little bit about what they do and how they've been working with the LGBTQA plus community. Hello.
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 Julie, how are you?
I am good. How are you doing?
I'm hanging in there, and we're all doing well, so I can't complain.
Okay.
What about yourself?
Pretty good. Hanging in there. Same. Can you tell me a little bit about what you do with In Our Own Voices and your role over there?
I am the CEO of In Our Own Voices. I've been the CEO of In Our Own Voices. I'm going into my 16th year.
Oh, wow.
And my responsibilities, I oversee the organization, the financial health of the organization. There are currently 16 staff that are working at In Our Own Voices. So it is my job to make sure the mission of the organization, the core values, and working with the board to make sure that we provide culturally specific and competent services to the LGBT people of color community in the capital region and nationally.
It's a big job.
Yeah.
So I guess the segue, can you tell us about what In Our Own Voices does and the community that you serve? You touched on that a little bit.
In Our Own Voices is a lesbian, gay, bisexual, and transgender people of color organization. We promote the health and well-being of LGBT people of color.
Awesome.
Which is the short version of our mission. We provide services, like we would like to say, in a three-prong approach: education, advocacy, and direct services. And so some of the programs that we have at In Our Own Voices are very unique. Some of our programs are LGBT people of color specific. And what we mean by that is that through the funding sources, and it lines up with our mission. An example of that we have programs that are related to violence, domestic violence and sexual assault that specifically targets LGBT people of color. Some of our health services, which is HIV and STI and STD services, are specifically for gay men of color or women who have sex with women of color. And then we're responsible for Black and Latino Gay Pride.
Yes.
So Black and Latino Gay Pride is one of two other major events that we are responsible for. We're also responsible for Unity Through Diversity, which is a biannual conference, which looks at the health and wellness of LGBT people of color community on a national level.
Oh, wow.
But back to Black and Latino Gay Pride. So Black and Latino Gay Pride is a program that, is a event, I should say, that we put together in 2006. So I think it's 13, 14 years old. And needless to say, when we first introduced Black and Latino Gay Pride to the community here in the capital region, it was met by a lot of opposition because the opposition folks were trying to kind of wrap their brains around why two prides. So 14 years later, there is still some opposition, but, you know, like I said, it's 14 years old.
Yeah, that's an impressive streak.
Yeah. So HIV testing, domestic violence services, we have emergency assistance, food pantry, we provide rental assistance, utility assistance. We also have support groups and individual counseling.
How long has In Our Own Voices been operating?
Since 1989.
Okay.
So we're looking at over 23 some years, about 23 years.
Yeah, that's a long time.
Yeah, it's a long time.
How have you seen the community that you serve change from then to now? I know there's been a lot of changes, but how have you personally seen that happen?
I think with the LGBT POC community, what has changed is the level of visibility. I think from, 89s and in the 80s, early 80s, the LGBT community, especially gay men of color, was really impacted by HIV and AIDS differently than now. I mean, now you have PrEP, you have medical interventions, but gay men of color still are at a high risk. They still make up the highest percentage of HIV cases among men, and so I think there's been a shift in how we do and look at the community of social determinants of health. I think it's more inclusive of what is the impact and what is impacting people of color communities that may cause barriers or are barriers to taking control of your health. So that has shifted a little bit. I think gay marriage really did, from my perspective, gay marriage in itself was a wonderful thing for the community, but for a lot of Black and brown people that are LGBT and sexual minorities, civil rights is still, and human rights are still, are really being pushed to the forefront. We're still impacted by racism, oppression, or marginalization. That's still going on today. Right. I think more so than in the 80s. I think it's more visible because of social media. And so I think overall what we're seeing is more visibility. We also are seeing more young adolescents transitioning and folks that are really on the binary spectrum of landing kind of and being accepted where they land on that binary spectrum. So I think overall there's just, I'm really excited to see how many LGBT people of color have a lot more opportunities, well, actually than I had growing up, but it's all good stuff that we are experiencing, but at the same time that there is this ability to really find yourself and where you lie on identity wise, gender wise. It is also very dangerous for people who are people of color. I think anti-Blackness is at one of the highest than I've seen in a long time. Where
do you see this community going in the future? I know we have increased visibility and such. Do you think that's going to continue as we go forward, especially looking at our political climate and such now?
I hope so. I think that, when I look at my nephews and some of the younger and our adolescents and our youth, I think that they're leading and they are really involved in what's happening more politically and knowing that they have the voice, and at any time that an injustice is really being committed, that they can use their voice and mobilize anytime. And with that freedom in itself, change is always going to happen. And I think that we're moving in a direction where the folks that are really at the margins are going to be brought closer to the center of justice and equity. So I'm hoping that I see that even the folks, the people that are change makers and the people that are disruptors, that they are doing some fantastic work around shaking things up. And the COVID-19 shook up a lot.
Yeah.
And so
definitely,
I'm looking forward to seeing, and I think that for the future, we are going to see more people of color more engaged in more political action. And I hope also that allies are really being that they become more accomplices and use their voices in ways to provide protection and also to call out more inequities and injustices more so, and with that understanding that being an ally is a 24 and 7 days a week job, that you just don't get the opportunity to take a day off as an ally.
Looking at COVID and all of the changes that it's brought, how are you continuing to service your community during these times?
Obviously there has been a impactful shift. And when I say it's been impactful, it's any time that you have to, we're practicing social distancing, we're working remotely. We're hoping that is going to shift very soon. We're hoping to be phasing back into the office really soon. But we provided remote services. We did provide emergency assistance, food. And so those are things that you have to kind of have conversations with people. I think being visibly to see a person in front of you makes all of the difference, and having that sense of touch from folks. So that has impacted our community. And of course, we know that communities of color and people of color are disproportionately impacted by COVID.
Definitely.
And so we've had a lot of direct and indirect deaths and effects around COVID that has us as an organization thinking of ways that we can do our work differently. And one of the things that we just did last Friday was we came up with up to a $300 mini grant that the LGBT community can apply for if they're experiencing hardship. So we are continuing our services, our counseling services. Our individual counseling services are done remotely through a HIPAA-compliant app. Our emergency assistance. We're also doing virtual trainings, and we've been very, very busy and meeting and trying to think of when we do phase back in, what does that look like, and how can we utilize what we've learned through COVID to apply it to increase our services and our reach of our services.
How are you guys looking at celebrating Pride this year, since the actual festivities are being moved? And
in our own voices, we postponed Black and Latino Gay Pride until 2021. But for June, we still have the raising of the flag at City Hall. That's going to be June 1st. We are still in conversations with the city, thinking of other ways that we can come together and have some celebrations throughout the month of June, which is next week. It's hard to believe that June is just next week.
Soon, Yeah,
it's soon. And so we have some events. We're working with the Pride Center of the Capital Region to come up with some ways that we can celebrate. We have a town hall that we're going to be doing together. We've joined other Black Pride celebrations throughout the United States. There's over 300 Black Prides throughout the United States and internationally. So they're really doing some good work. And then you have Global Pride in New York City. So there's a lot going on. It's just going to look differently. But number one thing is that we want people, and we want to keep people safe, and we want to do this in a way that is going to be safe. And the other piece of it is that we want to make sure that we have room to celebrate. But we also know that Pride is 365 days for all of us. But June is a special time, and not to forget why Pride, came together in the first place, which is Stonewall. That was an uprising against police brutality. And so, we want to make sure that we honor all of that. So, there is going to be a lot that's going to be happening. You'll hear about it in the community through social media. We'll make some announcements coming up soon.
Awesome.
And, there you have it. Our support line is 518-432-4341. And our website is inourownvoices.org.
Perfect.
I'm always available. Folks can always reach out to me. But I want to thank you, Jillian, for having me on. I appreciate it.
Yeah, thank you so much for this. This was great. Tell me your roles over at the Damien Center.
This is Junjulas, and I'm the Executive Director at the Albany Damien Center. I've been with the Damien Center now for 21 years.
Wow.
And I'm also a person who is living with AIDS, who is a part of the LGBT community. I've been living with AIDS since 95, so going on 26 years now.
And I'm Todd Kramer, the Associate Executive Director of Development, and my role here is to handle our communications and make sure that people know who we are and that we're here for them, as well as to raise the funds to keep our programs going.
Can you tell me what the Damien Center does and the community that you specifically service?
Absolutely. So we started the Damien Center back in 1988 as a response to the AIDS epidemic, mainly in the gay community. Okay. And at the time, it was really about helping people in the dying process because everybody was not faring well, obviously, with that pandemic. So at the time, 10 people would come into the Damien Center. By the next week, 9 of them would have been passed. Mm-hmm. The following week, 10 people would come in, and all 10 of those would have passed. So it was a very rapid fire, if you would, time for the Damien Center, truly helping people with that dying process. As the meds got better, and we learned more about HIV, we increasingly started to help people to learn how to live with the disease. And so today, we serve over 400 persons who are living with HIV, but they're having a tremendous amount of trouble accessing the medications that are helping to keep them alive, mostly due to the social determinants of health. So if someone doesn't have housing or food or support, they really cannot go to their medical appointments, or they can't take the HIV medications as prescribed. So it really is where the Damien Center is truly still helping persons in our community who are at most risk for having bad outcomes from HIV in our community. And a good majority of persons we serve are from the LGBT community.
Yes, so Jillian, our mission is to enhance the lives of people affected by HIV and AIDS in an affirming environment, and to reduce new infections in the communities we serve. And what Perry's talking about is all about removing the barriers and overcoming the obstacles of maintaining good health, thus reducing HIV to undetectable levels and reducing new infections as a result.
Has your community that you've served, so I know you started when the AIDS epidemic was going on, which was largely the gay community. Have you seen your community change over the years?
Certainly the disease did change to where it infected more of the general population, but still the highest rates of infection continue to be in the LGBT community.
Gotcha.
So I would say a little less than half of who we serve continue to be from the LGBT community. Particularly, we're finding rising infections in the age group of 13 to 24, and then also in our over 50 generation.
How have you seen the LGBT community change from the late 80s to now?
Well, at the time, it was, truly a pandemic, and I think that the hardest part for, those of us in the LGBT community was that we often felt we didn't have a voice. So at the time, we were fighting, not just for our rights, but for our lives. And so I think, certainly over the years, we have that base now, that's a part of us that is always willing to fight for what we need, and for the community needs. I do worry sometimes, and that, unfortunately, there has been a bit of complacency regarding HIV and AIDS, and that's not just specific to the LGBT community. I think that's overall. We don't hear as much about HIV in the news. People aren't dying we say we're not dying every 5 minutes, so we're not newsworthy. But people are still becoming infected, and I think that there's certainly members of, if you're of a certain age and can remember, the 80s and early 90s, it certainly is a bit of a different experience for you, with HIV and AIDS than if you are in your 20s, because you don't have that history of watching everybody around you die. And I'm thankful for that, because that's what we worked for so many years ago. We did not want to see a generation where, an entire generation was being wiped out. So we've come a long way, but I think we also still have quite a ways to go, because we do not have a cure, and too many persons are still contracting HIV and are still having some very bad health outcomes because of it.
How is COVID changing the work that you do, and how are you continuing to service your communities during another pandemic?
It was important to us right from the get-go to make sure that we were open and continuing to provide our services to our members who need us, and we've done just that.
Gotcha.
We've just had to get creative and rework how we do a few things. So we've had to implement some guidelines around social distancing, of course, and educate our tenants on best practices around that. We have 20 tenants on site here at the Albany Damien Center, and another 15 off-site that we support with housing. And then we've had to stop the drop-in to the living room, which is, a shame, because it's a place for people to go during the day when they have no place else to go and feel safe and have a shower and use the gym. We haven't been able to do that, but we have continued to provide our meals. Last year, we provided more than 38,000 meals to our members, both here on site at the drop-in center, through our pantry bags and food vouchers, and we continue to do that. It's just now the meals are either delivered, the pantry bags are delivered, or they can be picked up to go, so that we can minimize who comes into the center. And of course, we've restricted visitors such as vendors and any non-essential folks. And then non-essential staff are working from home during this time. And we're following up with folks, too, to help them feel connected, because feeling connected and knowing that you're supportive and you have people who care is critical. Right. And so we're staying in touch by phone, we're checking in with folks, and just making sure that all around they have what they need.
I think, Jillian, that's one of the things that COVID has really brought out, is that reminder that, we are social beings. We are, social human beings.
Yeah, definitely.
This reminded me a lot of the start of the AIDS epidemic, and also the LGBT experience, that felt very isolating at times, because you could not come out about your status, or you could not tell people that you were gay. And I think that now that people are isolated again, to protect themselves, it's bringing back some trauma, and it's bringing back some really strange feelings from long ago. So one of the things we're really trying to do is ensure that we are outreaching to every single person and ensuring that they have connections to mental health resources and substance use resources, but also maybe just someone to talk to. Maybe they just need to hear from somebody. And I think that social isolation is a very, very big factor in the LGBT community.
Those are all the questions I have. Is there anything else you would like to add?
Yeah, I really want to stress during Pride Month that we do have another program that serves our community well, and that's the Empower program. And the mission of that program is to improve the quality of life and well-being for our LGB and TGMB community. Okay. And these folks do not have to be impacted by HIV and AIDS to receive any services from us, whereas with our other programs, they do. And so we are here for any member of the LGB and TGMB community that needs help with health navigation. Maybe they need linkage to LGBT friendly healthcare providers. Maybe they need help with employment navigation. We do sexual risk education. And then prior to COVID-19, we had a welcoming drop-in space. It was just a safe place to go.
Oh, nice.
One of the nicest things about the Albany Damien Center, in my opinion, especially as an employee, is everybody is welcome. And you just do you. And I think that the Empower program really embodies that and lets people feel welcome and get services that they need when maybe they can't always get those comfortably elsewhere.
Since Pride isn't happening this year, the parade and such, how do you plan on celebrating, if you guys do?
We're taking part in the Pride flag raising ceremony that's coming up.
Oh, nice.
And we'll be using social media to certainly make sure folks know that we're here and to celebrate all around for the month of June.
That sounds great.
If folks would like to learn more about us, have questions about what we do and if we can help them, and if we can't help folks here directly, we can certainly make referrals to those who can. All they have to do is give us a call at 518-449-7119 or visit thealbanydamiencenter.org. They can also email info@albanydamiencenter.org.
I guess just one final thought, Jillian, just to leave you with is, one of the old slogans from the Damien Center from 1988 was, "You're not alone." And I think that's very appropriate for Pride Month, is to let people know that they're not alone, that we are there with them, and to reach out. We really enjoy hearing from people, and we certainly are there if you have a problem, but maybe you don't have a problem. You just want to stay connected. So please reach out to us. The Damien Center is here to help.
Thank you both so much.
The Albany Made podcast is a production of Albany Public Library in Albany, New York, produced by Stephanie Simon, Scott Jarzambek, and Ryan Slowey. You can find more episodes on SoundCloud, iTunes, and other podcast apps. You can also listen on YouTube at Albany NY Library and our website, albanypubliclibrary.org.